Good afternoon. Good afternoon. Good afternoon, and thank you everybody for tuning in to our regular Thursday afternoon press conference. I'll be back again next Thursday at 1 o'clock. As always, for more frequent updates, I really would encourage you to sign up for daily emails, which you can do at governor.ri.gov. You will see this afternoon a new face with me up here. I'd like to welcome Dr. Philip Chan. He is an infectious disease specialist who's been a leader in the Department of Health's efforts from day one. And I have asked him to come with us this afternoon. He's going to make a specific presentation about vaccines and what Rhode Islanders can expect as it relates to vaccine distribution in Rhode Island in the coming weeks and months. Also, Dr. Chan will be hosting a Facebook Live tomorrow at 1:30 on the Department of Health's Facebook page, and that will provide additional information about the vaccine. So I would encourage you please to tune in, and I want to thank you for all you've done from day one and for joining me this afternoon. Okay, so we'll begin, as I always do, with the data, and it continues to be a sobering picture. I'm not going to sugarcoat this. It's getting scary in Rhode Island, and don't take it from me, just look at the facts. This is an alarming picture. So yesterday we had 948 new cases out of 13,600 tests for a percent positivity of 7%, and very sadly, we also had another 14 deaths. And as these cases continue to rise, we know we will see continued increases in hospitalizations and continued deaths that follow. So my heart goes out to every single family. We've all lost loved ones in this crisis. We continue to lose Rhode Islanders every day, and my heart goes out to each and every one of you who are struggling to get through this pandemic. In the weekly data, you'll once again see 3 red arrows, not what we want to see, with a percent positive up to 8.9%, new weekly hospitalizations up to 427, and new weekly cases per 100,000 up to 846. On an average day now, a typical day, we are seeing more than 60 people admitted to the hospital. That is more than we've ever seen, much more than on our peak in the spring. 2 days ago, we had over 70 people admitted to the hospital in a single day with COVID-19. You may have seen that Rhode Island is #1 in America for cases per 100,000. That is not a distinction that we want to have. That is not where we want to be. There's a lot of reasons for that. We have the highest rate of testing in the country. We have a very dense population, a lot of multi-generational homes, and we are an older population with a lot of more folks per capita in nursing homes. But having said all of that, there's no excuse for it. It's not a distinction we want. And it's pretty simple why it's happening. People continue to not follow the rules. And as a result, more people are getting sick, more people are dying, more people are losing their jobs. Nationally, yesterday in America, we saw more than 3,000 deaths in a single day. That was the first time ever as a country we broke the 3,000 deaths in a day mark. So it's scary. It is scary. It ought to be a wake-up call for folks out there that still think it's not real, still think you don't have to wear a mask, still think they can sneak around and not follow the rules. I just want you to know that these data should be scary to you. But here's the thing. You have the power to protect your household. That's my message today for the people of Rhode Island. Do what it takes to protect your household. The power to protect your household is in your hands. And actually, it's pretty simple. if you just follow the rules. And I'm going to go into that in a few minutes. The question before me today is, should we extend the pause or end the pause? And I'd like to share with you how I'm thinking about that. As I've said over the past few weeks, mobility data, a measure of how much people are out and about, is a key indicator of cases. If people are out and about and on our roads a lot today, then we know we'll see more cases in a couple of weeks. If mobility is down today, we know that the cases will be down in a few weeks. I'm going to ask you please to put the slide up around mobility. There is some good news in this slide. The data is starting to trend in the right direction. So as the graph shows, the 14-day average of mobility in Rhode Island since September 1st, as you'll see, between September 1st and September 8th, we started to see a big uptick in mobility. Summer ended and people started to get back out and about, and then we saw an uptick in our data. You'll also notice the mobility spiked again around the end of October and early November, which again correlated with a larger uptick in cases a few weeks after that. But here's the good news. As you can see in the slide before you, the data has been moving in the right direction since about November 25th, which is right before we started the pause. And since the pause began, you see a steady decline in mobility. That's a good sign. If mobility continues to decline like that, it will almost certainly be true that we will start to see cases decline. In the last 2 weeks, we've seen 2.7 million vehicles on the road in Rhode Island, which represents a 12% decrease from the previous 2 weeks. So what that means is people are following the rules, and you should too. You should stay home. You should reduce your mobility. And if we do that, we'll get ourselves back on track. Having said that, it isn't the level that I had hoped to see. I had hoped to see after the pause precipitous decline, a quicker decline in the data, and we're just not seeing that. Hospitalizations are, of course, a lagging indicator, but we've seen no decline in hospitalizations, and we haven't seen a real significant decline in percent positive since beginning our pause. And as I said, there is a decline in mobility, but not as much as we had hoped to see, and we're definitely not seeing the decline in positivity. So because of all of that, and because we have, as I said in the beginning, pretty scary numbers with very high case numbers, I'm announcing that we're extending the pause for 1 more week, ending on Sunday, December 20th. So the pause will not expire until Sunday, December 20th. 1 more week of the pause. If we continue to stay home as much as possible for that week, for next week, I believe it will have the impact that we need. Again, you see the mobility data, it's going down. You see a slight decrease in the percent positive. I just reported 7%, it had been 10%, but it's not enough to stop the pause. So let's keep at it, let's stick to staying at home and honoring the pause for 1 more week. Now, as I say that, I can hear in my own mind the collective groan of businesses who are really getting hurt by this. And I'm sorry, it's really hard. This is a hard decision for me to make. I am certain it's the right one to make in light of every piece of data I have before me. But I know it's brutal for you to hear that you're gonna be closed or curtailed for 1 more week. I will say I've spent every day since I've been governor trying to improve our economy, and to have to throttle it back is especially painful. Having said that, I am announcing today that I'm going to extend the business relief for the one more week that we're in the pause. We've already received applications from more than 1,800 businesses, and we'll be mailing out the first round of checks for just over 500 businesses, totaling $10 million tomorrow. And in recognition of the 1 week pause, I have two more announcements about the program. First, we're extending the deadline to apply until midnight on Monday. So if you're one of the businesses that's affected by this pause, you haven't yet had a chance to apply, we're extending the deadline. You have until midnight Monday. It is a very easy application. It's very simple. Go to tax.ri.gov, tax.ri.gov, check a few boxes, and we will get the check on the way to you. If you want some more information about that program and how to apply, tomorrow at 11 o'clock, the Commerce Department is hosting a Zoom, an online webinar for you to explain how to apply and for you to get your questions answered. You can sign up for that at tax.ri.gov. Second, every business that gets a check for the 2 week pause, including those that haven't yet applied, but that are going to apply between now and Monday, is gonna get two checks to cover you for the 3rd week. So, and the second check will automatically be mailed out to you by December 28th. So let me see if I can make this clear. If you've already applied for money for the 2 week pause, you will automatically get another check to cover you for the 3rd week of the pause. And it'll be half as much as you received in your first check. If you haven't already applied, apply now. You have until the end of the day on Monday. And you will get your check to cover you for 3 full weeks of your lost revenue. So I hope that's clear and I can answer questions if not. I'm also extending the additional $200 weekly unemployment benefit to cover the 3rd week of the pause. Again, you don't need to do anything. It'll just come to you. It will be come to you in the same way that unemployment insurance is delivered to you, and any Rhode Islander who certifies for unemployment the week of December 13th will automatically get an extra $200. So although I know this is brutal to extend the pause for 1 more week, I'm also extending the economic relief to individuals. You'll all get an extra $200 for that week, and businesses will get another check, half as big as the first one, to cover you for the lost revenue of the additional week of the pause. I will say, with the extension of these programs, I think that what I've just announced is probably another $30 million of relief. I will have essentially allocated all of the federal stimulus monies that we have received from the federal government. It is my hope that the federal government or Congress passes another stimulus, which includes small businesses and individuals and rental assistance. And as soon as that comes, we will get that out the door. Okay, so now you may be wondering what happens after the pause. And because I want to give everyone an opportunity to plan, I'd like to share with you what that will look like. As I've said time and time again, we can't go from a pause to flipping the switch. It has to be a slow dial-up of our economy. By the way, as it gets colder and activities are moving indoors, it makes everything so much harder. So today, in addition to extending our pause for another week through December 20th, I'd like to talk to you about the restrictions that will go in place starting December 21st, and that will remain in place through the end of the year. And I'd ask you to please put that slide up on the screen. The slide on the screen before you shows what restrictions are in place now through the end of the pause, and what rules will look like after the pause lifts. Now, in many areas, there won't be any change, and those are the items that are listed in black. We want schools to remain open to in-person learning for as many students as possible. I want to give credit to a lot of superintendents and principals and teachers. A few weeks ago, I announced that high schools, if they wanted, could go virtual, and most didn't. They chose to stay in person or hybrid, and I want to thank you for that. Our kids are benefiting hugely. Every day a child can't go to school is a bad day for that child, and it's pretty incredible, all of you who've left your high schools open and just worked harder for the children. So anyway, schools, no change. We want as many kids in school in person as long as possible. Childcare, manufacturing, construction, and personal services, and they will continue to be open just as they are through the end of the year. Haircuts, barbers, nails, childcare, manufacturing, construction, all open as they are now through the end of the year. The current retail restrictions will remain the same also. It includes lower capacity limits for big box stores. And I would say, as a Rhode Islander and as your governor, please shop local if you can. Shop online and shop local. The big companies are doing just fine through COVID. The little guys are struggling. So if you're lucky enough to have the means to buy holiday gifts, I'm personally asking you to do all your shopping local. Keep the money in our economy. You can go to shoplocalrhodeisland.com and do all your shopping locally online through that website. Houses of worship are going to remain open at their current capacity through the end of the year. And I want to say thank you to the faith leaders. This is the big season, Christmas, Hanukkah, year-end celebrations. I realize it's incredibly valuable and proper to keep houses of worship open, and so we're going to do that. But I want to thank faith leaders because they've been working collaboratively with us, and they're going to make a number of adjustments over the Christmas and Hanukkah to make sure that people can worship in person, but also do it safely. I would say I would also like to encourage folks to worship virtually whenever possible. Bar areas will remain closed with drinks served only to customers seated at tables. I know that's a tough one, and that's why we're putting more stimulus money out the door. The items in red in your screen are the areas in which we're slowly turning the dial back up after the pause. Beginning December 21st, restaurants are going to be allowed to slightly increase their capacity, but still only seating people together who are from the same household. The name of the game between now and the end of the year is stick with your household. Protect your household. Venues of assembly, gyms, indoor sporting facilities, recreational venues that are currently all closed now will be allowed to reopen December 21st, but with new restrictions. So for all of you who are struggling that you can't go to the gym, starting December 21st, they will again be open. There's a lot of detail behind each one of these announcements. I'm sure you have many questions. What about funerals? What about wakes? What about this? What about that? All the detailed regulations will be posted soon on reopeningri.com. We'll get that done. I'd like to see it done by the end of the week or by early next week. At the first press conference in the new year, which will be Thursday, January 7th, I'll address then how we'll begin the new year. And man, I really hope we're able to dial it up even more at that press conference. But I'm trying to provide some guidance now so we know how we're going to get through the rest of the year. So as I said, I've said a few times, there's a clear theme in all of the rules. Protect your household. Protect your household. I want you to think actively. Stop thinking so much about what you can't do and start thinking about what you are going to do to protect your household. The reality is once one person in your house who you live with gets COVID, it's incredibly difficult, if not virtually impossible, to prevent spread throughout the household. But what you can do is make smart choices so you don't ever have anyone in the household to get COVID. So what does that mean? That means wear your mask all the time, anytime you're with people that you don't live with. If you don't, you're at greater risk and at greater risk of spreading. Don't have social gatherings with people outside of your household. Get tested often. We have, over the past few weeks, dramatically expanded the supply of testing. Tests are free. They are easier by the day to get. I want to say this. If you or someone in your household winds up in an emergency room, that's very expensive. It could be incredibly expensive for you. Getting sick can be very expensive. Getting a test is free and could save your household. Wearing a mask is free and could save your household. Thousands of people in Rhode Island have lost their loved ones. Don't let that be you. Go get tested. It's free and easy. You won't have to wait in line. And we'll get it done quickly for you. I guess, I don't know what it's like, wearing your seatbelt or something. Like you can, with such a simple thing, one test can save your household from being in the hospital, losing a life, or huge financial risk if you have an expensive bill that comes from the healthcare system. On the topic of testing, as I said, we've really increased our test. As of today, we have 5,500 daily tests reserved for Rhode Islanders with symptoms through portal.ri.gov. A few weeks ago, I said that by today, I wanted to be at 3,000. We are way past that, and we're continuing to bring in more testing. So if you feel sick, we've talked here at this press conference, people don't know how to get a test, people can't afford to get a test. Some of the private labs, unfortunately, are really gouging people. Just go to portal.ri.gov, portal.ri.gov. It is free, it is easy, you schedule it yourself, we'll get you the results quickly, we'll shoot you a text quickly. If you feel sick, go get a test. If you don't feel sick, go get a test. We want to test as many people as possible. We've also added more testing in the Dunkin' Donuts Center for people who aren't sick. We're using the new Binax Now tests, no equipment, very easy. It's simple. You'll know within 15 minutes. My goal is by next week to be doing 5,000 tests a day just at the Dunk. So I also want to remind you that things are a lot better now than they even were a month ago with testing, which is why I'm going over this. You can now review your own test online. You'll get a text, you'll be told your results are ready. You can go online yourself and get the results of your test. Since launching the texting service, which just about 2 weeks ago, we've sent over 200,000 text messages. So I can't say it enough. Go get tested, go get tested, go get tested. Let's say you did hang out with people over the weekend that weren't in your household, which you shouldn't have done, but if you did, go get tested. If you feel a little under the weather, go get tested. If you're just worried, you've got someone older or compromised in your life, go get tested. Sign up on your own, portal.ri.gov. It's free, it's easy. We'll shoot you a text. We'll tell you your results are ready. You can go online, get your own results. If you're positive, immediately isolate. Go home, shut your bedroom door, and avoid folks in your life and have people in your household go get tested. We will get in touch with you and see if you need a hand. Do you need a hand with food? Do you need a hand with healthcare? Do you need a place to live? You know, maybe you live in a crowded household. We'll help get you a hotel. And I also want you to tell everyone you've come into contact with. Call your friends, text your friends, and say, hey, I just was tested positive. So they know immediately, so they can go get tested and they can quarantine. It's on us now. It's on each and every one of us. The government can't do everything. You have to take control. So go get yourself tested, protect your family, protect your household, protect your friends. Do what it takes to protect your household. I want to take a minute to talk about schools. One of the successes of our ability to keep so many kids in school is that we're the only state in America that has set up a separate K through 12 testing system, which is working incredibly well. Like we're seeing very low positivity rates in the K through 12 testing system. At a testing event at Ella Risk Elementary School in Central Falls last week, Central Falls, like the highest percent positivity of any city in Rhode Island. At that test in Central Falls, we ran 182 tests and found a test positivity rate of 1.6%, extremely low. At the Racy's Dual Language Academy, we tested 72 students and found 0 positive cases. So K through 12 continues, it's safe to send your kids to school. The testing is going well, and the data from that test positivity shows low numbers. But it also means we have to test more. And I want to give teachers peace of mind, and students and parents peace of mind. So we're going to continue to test more. Over the next week and a half, we're going to be doing similar testing events at schools in Providence, Lincoln, and South Kingstown. And because this pilot has been so successful, we're going to launch it statewide in January. Statewide in January. Starting in early January, we will be offering on-site asymptomatic testing to any school district that wants it. So just testing of a whole entire school, whether they feel sick or not, on site, starting in January, which I hope is evidence to teachers how much we care, and evidence to our kids and parents how much we care. Testing is key, and so starting in January, every district will have the ability to do testing of everyone on site. That's not going to replace the K through 12 testing system. It's in addition to that, so we can detect cases quickly. In the meantime, we've also made K-12 testing accessible through portal.ri.gov. Before, teachers and students scheduling a test through the K-12 system had to call the hotline. Now you can still call the hotline if that's easier for you, or you can just sign up at portal.ri.gov. This is confusing. It's sometimes confusing for me, so I'm trying to simplify it. If you remember nothing else, go get tested, portal.ri.gov. If you're already used to using the K through 12 hotline, keep using that, and that'll be fine. I would like to take a minute to thank our school leaders and teachers for the incredible, heroic work that they are doing. It's every day a child is out of school is a problem for that child. And to those children who are already struggling for whatever reason, it's doubly so. We've tried to do everything that we can. We have a statewide pool of substitute teachers. We have over 6,000 HEPA filters now being delivered to classrooms. We're going to have testing available on site at every school in every district in January. I'm doing everything I know how to do to keep these kids in school. Teachers are working their tails off to keep these kids safe and in school. Same with principals and superintendents. I want to say thank you. To those of you who are throwing in the towel on our kids and going virtual, I think it's a shame. I really do. You're letting the children down, and I don't see any reason for it. So I'd ask you to rethink it. The statistics that are coming in around the harm to our children of being out of school are heartbreaking. Suicidal ideation among kids is through the roof. Bradley Hospital's overrun, Hasbro ER is overrun. Children are isolated, children are falling behind, children are scared, children who are intellectually, they are struggling. So this isn't easy. I am not saying this is easy. I will do anything you need to help you do the right thing, which is to keep these kids in school. Every day matters. So to those of you who are bending over backwards to keep as many kids in school as long as possible, I think you're heroic, and we're going to do more and more. And to the superintendents out there who've just decided to go virtual, I want you to look yourself in the mirror and ask if you can try a little harder, because I think the kids deserve better. To end on a happy note, tonight is the first night of Hanukkah. And I know Hanukkah is not going to be the way you would want it to be this year. It joins a long list of holidays this year that we can't celebrate the way we would like to. I think most of us can't wait until 2020 is over. So I'm sorry that you can't gather in person the way that you want to do. I'm sorry you can't all gather in the kitchen and make your latkes and together light your menorah. But I'm asking you to celebrate with your household and virtually if you can. You know, get folks together virtually, call your loved ones. Next year will be different, and this year I'm asking you to celebrate safely and creatively. I will say that the Hanukkah story is one that really resonates now. It's one that resonates now. It's a story of community, and it's a story of light, and light prevailing over darkness. This has been a dark year. 2020 has been a dark year. It's been the hardest year of your life for a lot of people. If you lost a loved one, if you lost your job, if you're about to lose your business, there's a lot of darkness. There's a lot of darkness. But in that darkness, we have to find the light. And that is what the celebration of Hanukkah is all about. We have to find our strength, and we have to know we're going to get through it. And that I do know. That I do know. And I know the people of Rhode Island are strong and resilient. And I know that the light at the end of the tunnel is quite close now. I know that because the vaccine is on its way. It's going to be arriving in Rhode Island in the next week, and we have a really good plan to get it out to everyone. So as we end the year, and as our Jewish friends begin tonight to celebrate Hanukkah, I would just say, let's all try to find some light to sustain us and hold on to hope as we get through these last few months of coronavirus. So I wish you a very happy Hanukkah. I wish you a happy Hanukkah, and I hope you're able to celebrate creatively with your loved ones. With that, and talking about the light that the vaccine will bring, I'm going to turn it over to Dr. Chan, who's working day and night to make sure we have a plan in Rhode Island to get the vaccine out safely and quickly and fairly to the people of Rhode Island.
So thank you for those updates, Governor. Good afternoon. My name is Philip Chan. I'm an infectious disease doc here at the Rhode Island Department of Health. I am absolutely thrilled to be here today to talk about the COVID vaccine. This to me is really the light at the end of the tunnel. This is personally what gives me hope. As the governor mentioned, it's been a long year, long 2020, but this to me is really the beginning of the end, and I'm thrilled to give you an update today about the COVID vaccine. So to step back for a moment, I want to share with you the 4 guiding principles that the Department of Health has had in thinking about the COVID vaccine. And I want to really emphasize, right, that we've been working on this for months, led by Alicia Mahalikis and Tricia Washburn, the co-leads at our Rhode Island Department of Health vaccine team. So we've been planning for months. This isn't something that's just been thrown together in the last week. Our guiding principles are this. First and foremost is safety. I want to really emphasize that. The state is absolutely committed to ensuring that any vaccine is safe and effective before giving it to a single Rhode Islander. And I really mean that, and we'll talk a little bit more about that in a second. Second, we want to minimize disease, which means that we want the vaccine to prevent as many hospitalizations and deaths as possible. We know that our hospital systems are really overloaded and our healthcare workers really pushed to the brink during the current second peak here. Third, we're working on and want to develop an effective system to distribute the vaccine. That's something, again, that has been on progress for months. And finally, access. And by that, we mean that every person in every neighborhood in Rhode Island needs to have access to the vaccine. We're very aware that things like transportation, housing, access to healthcare, all those social determinants of health can affect ability to access the vaccine. And we're actively working to make sure that every single person in Rhode Island can access the vaccine. I listed safety as our #1 priority because it allows really for all the other priorities that follow. Only when we have a safe vaccine can we ensure fairness and equity in distributing the vaccine. Only when we have a safe vaccine can we think about how to most efficiently distribute the vaccine to prevent as many hospitalizations and deaths as possible. So these vaccines are being developed quickly, and people have raised concerns about that, but we have made a commitment from day one to ensure that they're safe. And I want to reassure everyone that this is a long-standing process to evaluate the safety of these vaccines at all levels, and it's being followed to the letter. Importantly today, and this is an important day in the development of vaccines, is that the FDA is meeting to review the safety data on the Pfizer vaccine, and we'll be meeting a week from today to talk about the Moderna vaccine. And the purpose of these meetings is to whether or not they will grant an emergency use authorization, an EUA, for the vaccine. And I want to clarify a little bit this process because it can be a little bit complicated. So when the FDA is reviewing these vaccines, they essentially have a team of scientists, of doctors, of statisticians who come together and they scrutinize tens of thousands of pages of technical data for weeks, which is why it takes so long and why it's not something that can be done in a day or two. And they're really looking at vaccine effectiveness, importantly safety, potential side effects, and the manufacturing process in general. And when they look at side effects, they're specifically looking for anything that's unexpected. And while we're going to hear more from the FDA today, a little bit later today, what we do know is that tens of thousands of people have been vaccinated with both the Pfizer and the Moderna vaccine to date. And we're not seeing anything unexpected. And I really want to emphasize that. There's a percentage of people that are experiencing soreness at the injection site. They're experiencing a little bit of fatigue, body aches, et cetera. These are normal reactions after any vaccine. I will say, though, it does appear that we are seeing these reactions, specifically in these 2 vaccines, at a little bit of a higher rate. And so people have mentioned that, and it's something that the data is showing. However, these reactions are what demonstrate that the vaccine is working, right? It shows that your immune system is ramping up, that you are having a reaction, and that your body is making antibodies, which eventually are going to fight COVID-19 should you ever be infected. So this is normal and expected, and albeit at a higher rate than some of these other vaccines. Something else that's important to note is that the FDA doesn't look at summaries from the vaccine manufacturers. They really analyze the raw data. So as the group comes together and talks about this, they're really analyzing, again, tens of thousands of individual level patients that got this vaccine, which is why it takes a while. The FDA will then make a decision on whether or not to follow their advice. And in addition, I just want to really emphasize this in terms of safety. There's several overlapping safety systems. So even once the FDA approves it, they're in a place to monitor for any unexpected health reactions or side effects associated with the vaccine. And so there's several systems to make this happen. One of the most accessible ones, I think, is an app actually put out by the CDC called vSafe. And so that's available online. And anyone, doctor, patient, anyone, can report a side effect through that system to notify the CDC. And this is something we're all going to be watching closely from the national level, the state level, individual level, et cetera, to make sure that this vaccine is really safe once it comes to market. We have never had a vaccine that has been or will be more closely monitored than the COVID-19 vaccine. And I think all of us can see there's basically tens of thousands of news articles every day looking at this. So things are being scrutinized very carefully with this vaccine, which should be reassuring. In terms of timing, one thing I want to note is that this authorization from the FDA today, if and when they give it, will not be a green light for Rhode Island or any state right away. There's going to be a secondary process called the ACIP, the Advisory Committee on Immunization Practices, that's going to meet this weekend to make recommendations on how the vaccine should be used. And that's an important note. The FDA is going to recommend whether or not the vaccine can be moved forward. The ACIP is going to give us guidance on how it will be used. And so here in Rhode Island, we are going to look at that data in conjunction with the ACIP recommendations to really make a final recommendation for all Rhode Islanders. And of course, we're going to take all, if not most of that into account when we do so. So our Rhode Island COVID-19 vaccine subcommittee will hold their own meeting within 48 hours after the ACIP meeting is held to weigh in on all these findings, which will be publicly available for everyone to review. And they've been tracking these trials for months and have been watching closely. So if the FDA grants EUA status to the vaccine, and if the COVID-19 vaccine subcommittee feels like the safety review was sound, we expect people could be vaccinated in Rhode Island as soon as next week. So let me say that again. People could be receiving vaccine here in Rhode Island as soon as next week. That is incredibly exciting to me. If offered, I would be the first person at the door to get this. So again, this to me is really the beginning of the end of the pandemic. It's something we've been waiting for. I think it's really that bright light, piece of good news, I think, with all the challenges that have been going on here. So we've been ready for that here at the state, the Department of Health. We've been planning our vaccination phases using guidance from national organizations and our vaccine subcommittee. I'll ask if we can put that slide up on the screen, please. So as you can see in our current plans, high-risk healthcare workers, such as those in hospitals, long-term care facility residents, and first responders will be the first people to be vaccinated in phase 1A. Those are the people that we feel are most at risk and can benefit most from the vaccine. Our hospital workers will be vaccinated at hospitals. We've been working closely with our hospital systems here in Rhode Island. Long-term care facility residents and staff will be vaccinated at their facilities through a partnership we have established with CVS and Walgreens. And those logistics are being worked out as we speak. Other phase 1A people, such as first responders, will be vaccinated through 5 regional clinics that will be held throughout Rhode Island. And during the first few weeks, we anticipate that between 10 to 20 doses per week will be administered. After that, we expect that we'll be receiving roughly 32,000 doses of the vaccine each week. And that breaks down to 8,000 doses of the Pfizer vaccine, 8,000 second doses of the Pfizer vaccine, 8,000 first doses of the Moderna vaccine, and 8,000 second doses of the Moderna vaccine. And by second doses, what I mean is that both of these vaccines, both the Pfizer and the Moderna, are 2 shots, both 3 to 4 weeks apart. And so we have to reserve some of that supply, of course, for the second dose in people that got the first dose. As the vaccine comes into the state, we will eventually be able to open vaccine up to additional groups. And these include phases 1B, phase 2, phase 3, and then finally everyone else in phase 4. People in phase 1B are likely to include, will include people with more than one significant health condition, so people that are most at risk from complications, hospitalizations, and deaths, and older adults in other congregate care or more crowded settings. Phase 2 is going to include all older adults not yet vaccinated, K through 12 teachers, school staff, childcare workers, critical workers in high-risk settings, people with more moderate health conditions, and people in homeless shelters and group homes, and incarcerated or detained people and staff in those settings. So those are all groups that we believe are in higher risk of COVID-19 and associated complications. Phase 3 is going to be for young adults, children, workers in critical industries. An example of critical industries, for example, is the food system people who work in grocery stores, and they're planning on being eligible for the vaccine. And then finally, in phase 4, everyone else who has not received the vaccine yet will be eligible. While these dates are subject to change, and I just want to encourage people to be flexible and patient as we roll this out, we do anticipate phase 1 vaccination between December and February. So it's right upon us. So phase 1 vaccination between December and February. Phase 2, we anticipate vaccination between February and April. and phase 3 vaccination between April and June. So good news, by the summer, we anticipate the majority of phase 1 through 3 should be vaccinated here in the state of Rhode Island. So again, really fantastic news. I do want to temper expectations to say is that there are many variables that can affect this. Certainly, this whole pandemic has been a challenge from multiple standpoints, testing, the governor mentioned, PPE, so many other things, et cetera. But we are trying to work as fast as we can to get the vaccine out to people. Before passing things along to Dr. Alexander Scott, I do want to make a couple last points. One is that the state will be distributing vaccine to healthcare organizations and not to healthcare providers. The state itself will not be administering the vaccine to people. And this is a little bit of a different model compared to testing, where the state is doing a lot of testing and doing it themselves. Something else I want to share at this time is the amount of vaccine coming into Rhode Island and the timing of shipments are subject to change. So I did mention this number of 32,000. So this was based on the fact that we here in Rhode Island are roughly 1/300th of the US population. We've been told by the federal government that we can expect 1/300th of the vaccine allocated for the country. And so that's where the number of the 32,000 comes from. However, again, just to temper expectations, these figures are projections and they could change. That means we're all gonna have to be, again, a little bit patient and flexible as we get there. But I do promise that we will get there. Again, this is super exciting. And finally, I just want to give one shout out to my healthcare worker colleagues and friends, my community workers. I just want to say, I know we're in the second peak here. I know that things are crazy. They're crazy for all of us, but hang in there. This to me is a piece of good news and really, again, the light at the end of the tunnel for me. So with that, I'll hand it over to Dr. Alexander Scott.
Thank you for those updates, Dr. Chan. Thank you, Governor, as well. With today being the day that FDA is going to be evaluating the science and the data, I was inspired to pull out the spectacles so that we can be ready. Rhode Islanders can be confident that in addition to my colleague in infectious disease, Dr. Chan, there's an entire team of people across state government and at the local level who have been planning on this for weeks to ensure that we have a safe and effective vaccine available and accessible to all who are at higher risk and who need it. I want to particularly recognize and thank Director Courtney Hawkins, as well as Alicia Mahalikas and Trisha Washburn, all tremendous leaders in helping to ensure that we do this well and effectively, which we know that we will. Very briefly, I want to circle back to something I referenced last week. The Centers for Disease Control and Prevention has posted some new information on quarantining, as I had shared. This updated guidance adjusts the quarantine period for most people. We want to share that that will be rolled out here in Rhode Island. The data is helpful and it's effective to continue to ensure that those who are a close contact quarantine and stop the spread of coronavirus. If you are a close contact, you should now quarantine for 10 days from your last exposure to the person who had COVID-19. Close contact means you've been within 6 feet of someone with COVID-19 for a total of 15 minutes within a 24-hour period. After quarantining for 10 days, you can continue to resume your activities, but should continue to monitor yourself for symptoms very carefully over those next 4 days. That's how we are able to make this adjustment. You can also shorten your quarantine to 7 days if you have a negative result from a test taken 5 days or more after you were exposed. All of this guidance is available for people who do not have symptoms. It's important and an opportunity for us with going forward. The governor shared the different testing options that are being ramped up. We really want to promote them so that you are testing frequently, particularly if you are in a high-risk group or in a location where cases are higher. This will also allow testing to support quarantining. Someone who quarantines for 7 days after getting a test from day 5 or after should also, for the remaining 7 days, continue to monitor themselves for symptoms. If you get symptoms of COVID-19 during any of those time periods, the same message remains. You should stay home to recover and isolate safely there. You should call your healthcare provider and go ahead and get a COVID-19 test as soon as possible. We have many venues for you to be able to do that. And as has been shared, there's increasing ability to get the test on the same day and quickly and get access to your results. Learn more about what to do at health.ri.gov/COVID/what to do. There are some exceptions to this updated guidance on shortening the quarantine period. Very few. For example, if you are a resident or staff of a nursing home, you should still quarantine for 14 days. The last thing that I want to say is that we are updating our web pages across state government. We want to continually make this information clear, simple, and available to you. They can be complex, and so we want to keep working with you so that you can understand, take action into your own hands, and be able to effectively protect your household. So over the next few days, people should expect to see a different look and feel that's easier to access on our websites. And with that, I'll open it up for questions.
Dr. Scott, with the outbreak at the ACI, people have been calling for lowering the population at the ACI to deal with it. Dr. Jennifer Clark, who's the outgoing medical director, said the effort to reduce the prison population should be underway. What are your opinions on that?
We are aware of those thoughts. With the transition of the medical director care at the Department of Corrections, the Rhode Island Department of Health has been working closely to help ensure what's needed to quell the outbreak there has been taking place. We meet regularly throughout the week. We support the Department of Corrections in the approaches that are taken to help minimize risk of spread. And they know which units it's acceptable to perhaps think through those practices and which are not. So our focus is to support the Department of Corrections leadership, help ensure that there isn't any increase in spread, and make sure that our inmates and staff remain protected.
Right now, the DOC only updates the public at most once a week on Facebook. As part of the web update you just mentioned, could this be done more often so that people would have a better idea of what's going on?
You always also, as the press, have the opportunity to reach out to the Department of Health and the Department of Corrections. We can provide information as needed.
From people in the community, family members and such.
Yeah.
Has anyone died at the ACI from COVID that we know? Because we're not hearing those numbers either. And there's a lot of rumors coming out that people are dying. I'm hearing bodies dropping. So I'm wondering if anybody's actually died, if we know of that.
That rumor is not a correct one. We're working closely with corrections. We do not have scenarios such as that.
And lastly, a medical professional suggested that giving the incarcerated more time outside where spread is lower, perhaps using the National Guard to help with supervising more yard time might be a good idea. Right now, we're keeping cramped up in small confinement where spread is high, but if we got them outside more, maybe that would help. What do you think of that?
Thank you for that. We are applying all measures that are effective and able to be applied within corrections.
And lastly, Governor, do you have any opinions on using your authority to lower the prison population? I've been told that under Rhode Island General Laws 425618, you have the power to modify the criteria for reclassification and to temporarily grant parole, including medical parole or temporary furlough.
Yeah. So first of all, I like the ideas that you said before, and I'll look into both of them, both in terms of using the guard as well as the transparency. A few thoughts. I do not have that authority. I'm quite certain of that. Also, I think it's important to recognize that we're dealing with max security here. So earlier in the pandemic, I did work with the courts. The courts have the ability that you speak of to encourage the early release of a small number of low-level offenders who were within, I can't remember, 30 or 60 days of release anyway. This is different, that these are, in some cases, violent offenders much more serious crimes. Having said that, the courts have that power, not I, and I don't think, given the circumstances of what we're dealing with right now, it would be appropriate.
Governor, you said one of the reasons that the infection rate of Rhode Island being the highest in the country is because people still are not following the rules. What evidence do you have to suggest that people are not following the rules? Was there a problem with Thanksgiving? Do you know that there were outbreaks based on Thanksgiving gatherings? What does the evidence show?
Yeah, so it's a great question. So I was showing earlier in the data how much mobility really increased in mid-September and then again in October. We know we saw a lot of issues around Halloween. Parties did lead to increases. Quite frankly, it speaks for itself. In other words, we know that you see it now even, like when mobility goes down, cases go down. When mask wearing goes up, cases go down. So, and also we know from the contact tracing, while it isn't perfect, it is like clear as day when you can see one party, like we have talked, you and I have talked about that one party in the East Bay verifiably led to, dozens of cases. So that's what we have.
The percent positive has kind of gone down a little bit the past couple of days. So do you attribute that to the pause?
Yes.
Do you attribute it, do you think people mostly did follow the rules around Thanksgiving?
That I don't know. I'll be very honest with you. I do not know. I don't know. That's a hard thing to know because it's hard to be in people's homes. But that tiny decrease in test positivity from just about 10 to 7%, yeah, I do attribute that in part to the pause. And you can see it in the mobility going down, which is why I want to continue the pause for one more week.
And just finally, you noted again, you said it was shameful, these schools that are going remote before the holidays. This comes as the unions want all the schools to go remote. And obviously you're going to get a lot of pushback on this. The teachers are very upset, thinking schools are upset. I know you've had the same answer all the way throughout. What do you say to them today now, saying it's shameful that some of these schools are going to remote when you let high schools do that, but you don't want to do it for K-8?
My position is just very clear on this. I feel for teachers. I really do. This is the hardest year they'll ever work in their careers. By the way, that's also true for doctors, nurses, truck drivers, grocery store workers, social workers, the DCYF social workers. It's a brutally hard year. And I in no way want to minimize how hard this is for teachers and the deep respect that I have for teachers and what they're doing. The harm that is being done to our children by not being in school is massive, and these children in many cases are going to face like lifelong challenges because of it. So my job as the governor is to keep the kids in school and then to do what we can, passing out thousands of HEPA filters, testing more completely, providing more substitute teachers, providing the supports that we can to keep the kids in school. But I have thought from the beginning in this entire discussion, the focus has been more on, the focus hasn't been nearly enough on the downside to children of being out of school. So I don't have much to say. I am where we are. Also, look at the facts in school. I mean, we go into Central Falls, which has it's very densely populated community. Test positivity is almost 20%. And in particular schools, our test positivity is less than 2%.
In regards to you calling out some school districts who are going to remote learning, a lot of these school districts, or the unions have said it's because of staffing shortages. So how do you square the two there in your pointed message, and are you doing anything to sort of help those school districts get more staffing in order to bring their kids back?
Yes. So again, I'd say, I never said this was easy. I understand it's hard. So they have to find a way to be creative to solve these problems. If staffing is a problem, you have to get creative to solve it. If facilities are a problem, get creative to solve it. We have a whole command center, only state in America with a command center that does nothing but support our schools. With substitutes, I have asked Rhode Island to help be substitutes. And we have an amazing pool of substitute teachers, hundreds and hundreds of teachers. So yes, it's hard. We'll give you a hand. We have substitutes. Look, I don't think the question should be, is it safe to have kids in school? The answer to that is unequivocally yes. Ask any public health expert in the world, and they will tell you, yes, it is safe to have kids in school. Ask any parent or teacher or pediatrician, do kids do better in school? Unequivocally, yes. So the question is, what does it take to have the conditions in place for kids to be in school? And that's just work and creativity. More HEPA filters, more windows, more facilities, more teachers, more support. So let's figure out a way. Let's do what it takes to give the kids what they deserve.
Governor, I have a question for the governor.
All right, go ahead.
Dr. Megan Rainey, Brown University, she's on CNN quite a bit. She basically laid out all these different scenarios, but couldn't pinpoint one reason why Rhode Island was considered number one.
Yeah.
So Governor, isn't it possible that, I mean, we're between Connecticut and Mass. I see people wearing masks. You've been proactive. You announced the pause.
Yeah.
Is it possible that, I mean, as much as you say people aren't following it, it seems just to be a mystery to medical science of why it's spreading so rapidly.
Yeah. So listen, I think there's some truth to what you say. I'll say this. If you look at cases per 100,000, we're number one in America. But if you look at test positivity, which accounts for the fact that we test more than most states, we're kind of middle of the pack. Like our test positivity is average in America. So you make an excellent point. And some of this stuff is out of our control. We're densely populated. You know, there's no really rural Rhode Island to speak of. Densely populated, a lot of multi-generational homes. You know, mom, dad, grandma, grandpa, aunts and uncles, all in one home. Lots of people in nursing homes, lots of older people. So yes, I think you're right. And I think that's what Brian was getting at. And maybe I was wrong in saying, you know, it wasn't rule following, although there's plenty of that. Our test positivity is kind of in the middle, and that's because we're testing so much. But what I do know is this, we can't stay at this pace. You cannot have 70 people going to the hospital every day. I've got to stop that because we won't be able to, hospitals and the field hospitals will be over full. And that's what I have to prevent.
And just speaking of the hospitals, Governor Baker announced they're going to stop elective surgery in Mass. You've hesitated to do that, but you also mentioned the field hospitals are wildly expensive to operate. Yeah. Is that something that you're looking at?
No, not at this point in time. We are in like daily contact with the hospitals. We're going to let them manage it. I'm not going to tell them how to manage it. We have the field hospitals, they're shuffling, and we're not there yet.
God, can you take us inside what major changes you're making? Let's say, okay, we're in the one metric, we are the worst in the world right now. Other metrics, we're in the middle of the pack. Either way, it's not very good right now. Yeah. So what was rolled out today isn't a very significant change from where we've been. And certainly if you look to a week and a half from now, it looks like we're going to be loosening up some restrictions. Mm-hmm. What changes are you making to get the numbers dialed in?
Okay, good question. We're continuing the pause. Like I said, the early data suggests the pause is working. Traffic's down, mobility's down, test positivity is down. Not significantly, but it's not up, it's down. So I think the pause is working. Let's stick with it for another week. Secondly, we are like tripling testing. That's huge. Don't underestimate that. Thirdly, we are deep inside our high density communities, all over Central Falls, parts of Providence and Pawtucket, deeper than we've ever been. Testing in the community, in church basements, in schools, they're renting additional hotels to allow people to isolate safely in those communities. So it's a combination of the pause, but also the testing and then super pinpointed in these high density communities.
Does that include the nursing homes and prisons and any other congregate care facilities, or is that just zip codes?
When I say high density community, I mean primarily Central Falls, parts of Providence and Pawtucket. So I guess zip codes. where our test positivity is still high, but we're also making changes in nursing homes. So for instance, in nursing homes, we just opened our first 3 isolation units within 3 nursing homes. That's new, right? So we're getting better at putting people into isolation units within a nursing home.
Dr. Governor, we're seeing small businesses defying some of these regulations around the country. We've seen it here locally with gyms. As you extend this pause, are you prepared to see more of that, and how did you handle that?
Yeah. Listen, the reason that I decided to extend the economic relief with the pause is to try to prevent that. It's really hard for them to obey because they lose business. So to make it easier, I'm sending money out the door. We have not, thank God, had a lot of the problems of other states with full-on refusal to follow the rules. I think some of that is because we're sending money out the door at the same time. But listen, if people don't follow the rules, then we're gonna require them to do that. You know, we've had some lawsuits, and we'll continue to defend the rules.
Dr. Alexander Scott, good afternoon. So the quarantine revisions that you talked about, that's a reflection of what the CDC has talked about, right? In terms of the lowering of the quarantine and the testing and all that, right? At the same time, the CDC says there is no indication that indoor swimming pools are a cause of spread, yet the state has lumped them in with other indoor sports facilities. So how do you square that with, there's an aquatic center in East Providence that has state-of-the-art filtration system, has put up plexiglass, done all of those things, high chlorine count. How do you square keeping them within other indoor facilities with the closure? And why would you consider that specific subsection of indoor facilities to remain open?
All of our decisions are a balance. It's based on guidance that we've received, but it's also based on our own local data and also our understanding of the virus and the science behind how the virus spreads readily. We wanted to have the pools that are part of gyms follow the same alignment, except if someone is using a pool for therapeutic reasons. If it's needed for those reasons, that has been allowed in certain situations. But if you think about it, the virus spreads more when you're indoors, in informal settings where you're not able to wear a mask, in inconsistent groups. Where pools are, the smell of chlorine is even stronger when you're indoors. It's a sign of what's happening with the air. It's harder to ventilate adequately. You're breathing harder if you are swimming there recreationally or for other forms of exercise. And so we wanted to take the major scenarios that are at increased risk of causing super spreader events and pause, minimize them during this time frame. As we go forward in the phase after that the governor shared, we will be addressing it, but during this brief time, that was the driver behind our decision.
This particular place is not associated with the gym, and it's a standalone aquatic center. Your department is familiar with this place because they've had much interaction with it. I don't know if you or anybody at the health department who's making these decisions is actually a swimmer. But when you exhale into the water, and you're not near anybody, and you wear a mask right until you get to the pool. So all of what you say sounds fine in theory, but in practicality, it doesn't stand up because they have high filtration, the doors are open, and all of that. So, you know, the easy way for government is to say we're going to put everybody into one category, and because the science says, and the huffing and puffing and the breathing. The more difficult thing is to look at this specific business and any other like it and say, you know what, maybe we should carve out an exception. They have 1,800 people who use this facility.
Yeah, it's certainly something that we understand. We made the exception for those that use it for therapeutic reasons. And though people are breathing into the water, when you come up, the air there, it's more challenging. It's indoors for a period of time. It's the type of environment that is conducive to increased risk of spread. During this brief time period, it was part of the decision-making that we made.
Governor Raimondo, with regard to dollars and cents, You and I have spoken on a number of occasions about shared sacrifice, austerity budgets, the notion that as the small business infrastructure in this state literally is collapsing around us for admittedly exogenous reasons, there was at least the expectation that there would be some type of financial responsibility. Instead, the state has delivered effectively a $12.7 billion budget, increasing the budget, guaranteeing no state layoffs or allegedly no cutbacks in salaries or overhead. In a state that's got a GDP growth pre-COVID that was less than half of the national average, in one of the worst funded pension states in the nation, and that's not even counting the city of Providence, in a state that is virtually on the verge of collapse, arguably, of course, exacerbated by COVID. At what point in time does the state exhibit any sort of financial responsibility? By the way, we're talking about $400 million more in bonding that will probably be passed, saddling the state with a bonding level, a debt level that's roughly equivalent to its annual budget. At what point in time do we recognize reality and try to ask the question of the year, who is going to pay for this?
Yeah. So listen, it's a difficult budget, and I give the General Assembly credit for coming back and trying to pass a budget. There are numerous cuts in this budget and in every budget we've passed in the past number of years. There are no tax increases in this budget, which was important to me, and I know the Assembly, which is different from many other states. And I think it's very important to not increase taxes. In fact, there are some additional tax cuts in the budget. And I support the bonds. It's investments in affordable housing. We have a housing crisis in Rhode Island, and during a health pandemic, people need and deserve affordable housing. They're investments in childcare, investments in pre-K, which our children need. So again, we have disagreed in the past. I agree in the necessity for fiscal responsibility. And I have made a lot of hard choices as governor and as treasurer to try to be fiscally prudent. And every budget that I've signed has involved tax cuts for the people of Rhode Island. But right now is not the time for austerity. And don't just believe me. Talk to the chairman of the Fed, talk to the economic experts. The danger now is not investing and passing an austerity budget. We got to get Rhode Islanders back to work. And that $400 million of bonding is going to put a lot of people to work. So I think of it as investments. If the federal government doesn't come through with the stimulus, yes, furloughs are on the table. I honestly don't see how we get through it without it, and many other, more difficult cuts.
They were talking about budgets that are quote unquote being cut, but the number is rising exponentially. And again, the central question is, in a collapsing business environment, who's going to be left to pay for this?
Okay, again, I reject the premise. This isn't exploding or collapsing. We are in a crisis now. We have an economic crisis as a nation now. I happen to believe part of the way out of this is to invest. And that creates jobs in the short run and in the long run. And when you say who's going to be paying for it, that's why I keep referencing taxes. I think it would be a terrible time to raise taxes on, everyday Rhode Islanders. And so we're not going to do that. And we're going to cut accordingly in order to make that possible. But we also need to invest in healthcare, housing, childcare, clean water, because I think that'll pull us out of recession and make sure the recession isn't so protracted.
Governor, your plan is to partially lift the pause after week 3. What if the data do not improve or they worsen?
Listen, from the beginning, I have said I'm going to govern based on the information before me. And so I always reserve the right to make changes. If they worsen substantially, then I would have to make a change. It's hard to believe that would happen in the next week. I think we have a pretty good sense of what it's going to look like in a week. And also, the next phase is just a slight dial-up. And it's hard, to the question we were just talking about with gyms and pools. I want to get them back open as fast as possible. They've suffered enough. So long story short, it would have to deteriorate significantly in a way that I don't now anticipate in order to extend the pause again.
Governor, just a couple of high school sports questions. You know, at a time when you continue to stress about the importance of in-person learning, what are some of the hurdles that your office is kind of dealing with to at least allow kids to, at the very least, practice, especially with a lot of kids, as we know, come to school because they participate in sports?
Yeah. So I should have said this, so thank you for the question. We are in pretty much daily contact with the Interscholastic League, and they, as I understand it, they were waiting to see what I said today, and then they're going to come out with their own plans for the winter season, and we'll support them to do that. They've been fantastic. They have been following the rules. So I can't speak for them. I don't know what they're going to come out with, but we want to support them to help the kids, you know, play, as you say, even just for practice as much as possible. So I'd say call the Interscholastic League, and I think within a few days they'll have more guidance.
Governor, you talked today about keeping gatherings small, if at all, for Hanukkah, as you did for Thanksgiving. Do you anticipate this guidance continuing through Christmas?
The big question. So Christmas is still 15 days away, and the rule is stick with your household. So I would say for the purposes of your planning, you should be planning a small household Christmas. You should not be traveling, and that is what I will say.
I have a quick question about vaccine distribution, if you don't mind. Either one of the doctors, whatever works. I'm just curious as to why the state isn't going to be administering this when you have all of this structure in place.
Yeah, so it's a great question. So the state has a lot of people in place for swabbing, but not necessarily for administering vaccines, which tend to be additional healthcare trained people. So we're going to work with the healthcare system, and especially in the places where we're looking to get that out first, such as hospitals, long-term care facilities, all of which have medical directors and nurses. It kind of makes sense to work off existing infrastructure.
Is there any thought in the plan to putting the vaccine in some of these high-density communities that have been hardest hit first? I didn't see that in the chart. Is that at all part of the consideration?
Absolutely. Well, so for phase A, we're going to prioritize the hospitals and the long-term care facilities. But as a second step, absolutely, in all following steps, we really want to prioritize, similar to testing, we want to prioritize vaccine in those areas, and we'll be setting up distribution plans and working with clinics in those hotspots.
Doctor, the hospitality groups in the state put forth a recommendation today that they'd like to see their members vaccinated towards the top of the pile. Is that appropriate?
So it's a great question. You know, the vaccine subcommittee is looking at all groups, all populations, and we're certainly willing to consider. And it's something that the broader vaccine group will weigh in on.
Doctor, can I ask you about the phases? If I'm reading this correctly, I fall April to June, and unless something's done. But apparently in phase 2, murderers at the ACI, they're going to receive it in February. Is that a typo, or am I reading that correctly?
No, so the ACI is a congregate living setting, and I think from a previous question, we are having outbreaks there. And I think ethically, we have to vaccinate that group. We have to take care of that population. We are fitting them within the scheme of vaccination that makes sense for that group. And certainly, again, let's keep in mind here, right, that we are on the upward slope of a peak. I think in the near future, we're going to come down. And vaccines, along with masking and physical distancing and everything else that's being recommended, that's going to hopefully accelerate that downward curve and flatten it out, hopefully forever, and that will be the end of the pandemic. So vaccine is one key, one part of it.
Just one question about the vaccine. I'm reading that you can't drink for 2 months, and also a lot of people felt lousy the day that they had the second one. Is that consistent with what you're seeing?
So there's still, I've heard, and based on reports that are coming out, we do know that people tend to feel a little bit worse after the second dose. And again, that's attributed to the fact that people's immune systems are reacting in a positive way and building up antibodies. But there's still a lot that we don't know about this vaccine and a lot that we're learning. So there's a lot more data to come. The CDC, the ACIP will be reviewing all of this and issuing firm recommendations on who should and shouldn't be getting the vaccine.
Chairman.